All right, everybody, this is Dr. Blake Cason. Welcome back. Thanks for joining us today. We're going to be talking about something that we've all probably experienced a little bit or maybe a lot of in our life. It's lower back pain. You know, one of the most common reasons why a person goes to a medical doctor is because of lower back pain. And the lower back pain has become so bad that they're starting to be affected on a daily basis, whether it's stuff they like to do around the house with their family, or stuff they like to do, or they're required to do at work. So, typical visit like that, the patient's going to come in with pain. They're saying, why is it there? You're going to see two things happen. Either they're going to be given anti-inflammatories, or they are also going to maybe muscle relaxers. And we'll also go maybe to a physical therapist office, and let's talk about why that happens. So we're talking about this low back issue right here. Okay, lower back pain here. When it seizes up, you feel it, right? It grabs you in the low back, maybe even in the leg, that area. It's hard to do much of anything at that point. So what's happening there? So these movable joints here are actually protecting your spinal cord. Your spinal cord carries information from your brain to the rest of your body. Very important. If you want to stay alive, you want your spinal cord to work properly. Now, when this misalignment occurs, it starts putting pressure on that system. Okay, and it sends your body into panic mode. Those muscles in that area want to grip up around there to support that area of instability. So that muscle spasms up. That's why that pain shows up through here. You can barely move sometimes. So the muscle relaxer helps that muscle relax. Maybe it will give you decreased pain, but with that problem still in there, is that dangerous? Your body's actually trying to protect that area that's unstable right now with that muscle spasm. So when I see a patient that has this issue, they come into my office with muscle spasm, lower back pain, we always want to look to this area because it can be affecting a few different things. The organs in that area mainly are for your digestion, the way you take food in and that basically get rid of it through the body. A lot of it is ran through our lower back nerves through there. Now, if that area gets pinched, a lot of those patients that have that pain that I'm talking about, they'll experience constipation, diarrhea, IBS, acid reflux. It could be a number one of those things, but a lot of times they show up together. And I want the patient to know that not only because it's the muscle in here spasming, but those nerves in that area go to this area as well, in your vital organs here to help you digest foods. When a patient comes into my office, we want to make sure that this low back works properly, and you start seeing both of these get better. Their digestion gets better, their back pain gets better, and after we start adjusting that area, I want to find the imbalance in there. Where's the weak muscle? Where's the tight spasmed muscle? And they're usually kind of fighting each other in that area, reacting to what's going on here. So then we strengthen that area as well that's weak, and we relax and try to stretch and show the patient how to do these at home, how to stretch those tight muscles so those muscles come back into balance and their adjustments last a lot longer. So hopefully you learned a little something today. Definitely give me a call if I can help you. If anything like this sounds like might be happening in your life also. Stay tuned, and we'll see you next time.